Hey there. What's the number one reason you decide to go to a doctor? Well, it's to get well, right? But let me break this down just a little more. By the way, I'm Jason with Ocala Infectious Disease and Wound Center. We provide restorative medicine for people with simple to complex diseases and wounds, aiding you to wellness, resulting in a better quality of life. I'd like for you to stick with me for just a few moments as I explain the Ocala Infectious Disease and Wound Center wellness model. And if you stick with me, towards the end, I'm going to reveal what happens if you don't follow our wellness model. Sound good? All right, let's dive in. Whether you were referred to us by your primary care provider, a doctor at the hospital, your urologist, or you were a self-referral, there is a medical issue that you're struggling with, and it's preventing you from being well. And that's what we all want, isn't it? Your other doctors, us, and especially you as the patient. We all want the end result of you getting well. What we've identified through working with thousands of patients and hundreds of other doctors that refer patients just like yourself to us is this: you being well is multifaceted. And here's what we mean by that. You want faster results. You want trust plus confidence, and you need collaboration with your medical team to make this happen. Now, here's the amazing thing and where our wellness model really comes to life. In order to achieve faster results, there has to be a proper diagnosis. And we have to set out to solve that diagnosis in a timely manner. That's why our team is trained to respond to your referral within 24 hours, whether from another doctor or even if you self-referred yourself. Now, what we've also found is that being able to diagnose and solve a simple or complex disease or wound is not good enough. We also have to prevent it. And this just isn't for those chronic recurring issues. This is for those acute illnesses and wounds that you may be experiencing as well. You see, if we're able to solve and prevent, this is going to build that trust plus confidence with you and with your referring doctor, which brings us to collaboration. The medical field is constantly changing, and even more so in the area of infectious disease and wounds. As bugs and fungi and viruses and bacteria, they're all increasingly morphing and adapting, becoming resistant to common age-old treatments. It's literally impossible for a single doctor to know it all. So, by working in collaboration together, you and your doctor, you and our team of providers, we are not only able to diagnose, but also prevent these ailments and reduce occurrences of your recurring symptoms and illnesses. Now, a moment ago, I said I was going to reveal to you what happens if we don't diagnose, what happens if we don't solve, and what happens if we don't prevent. What ultimately happens is the patient, that's you don't get well, but there's more to it than that. You see, it's possible to diagnose and prevent. But if we miss solving, we end up with no solution. Likewise, we can solve and prevent. But if we solve for and prevent the wrong thing, there's going to be no resolution. And here's the kicker. We can diagnose and we can solve all we want. But if we don't work together to prevent, there's no lasting solution. In other words, if we don't prevent, there's no satisfaction. So, if you'd like to be well, if you would like faster results, If you'd like to have trust plus confidence, and if you'd like collaboration to help move you from no resolution, to move you from no solution, and to move you from no satisfaction to actually being a well patient, I want you to click the link below right now.